Hi, Dr. Virenji here from Bida Healthcare, and today I'm sharing with you another sort of frequently asked questions session. Today I'm discussing about lung diseases, especially the ones that I'm going to list below. You'll forgive me for the science, but we'll break them down. One is asthma, a quite common illness. Another one is called emphysema. Another one, a group of illnesses called COPD, or chronic obstructive pulmonary diseases. So the reason I'm discussing them is I've had so many questions coming through, and I thought that it would be important to discuss these illnesses. This video is sponsored by C247 College Use and Complete. You can go to www.bidahealthcare.com to find more information about these three supplements I've talked about. So going into the discussion, asthma and the COPD we're talking about is usually a long-term illness that results into obstruction of breathing. Sometimes you can present with cough, sometimes there is that noisy breathing that is wheezing, and people become breathless. And of course, it has also an associated mortality or death rate that is associated with asthma. Usually, if I talk about asthma, I'm looking at mainly children, but also there's also asthma in adults. And usually it is a it is an illness that comes out of a lot of hyperactive immune system, where the body's immunity is responding to certain things that a normal person shouldn't be responding to. So there is some sort of hypersensitivity syndrome related with their immune system. So of course that comes through so many reactions that will happen with the body, and then someone presents with wheezing, they're breathless, sometimes there's some sort of mild cough, or they are not able to actually do anything for themselves. So the mainstay of treatment or management is usually diagnosis, of course, like I've been saying. Anytime you have an illness like that, you need to seek expert advice of a qualified professional to be able to manage your case, to handle your illness. When I talk about COPD, all the chronic obstructive diseases in the old, usually there are destructions that happen at the lung level, and so you find that if someone is not able to, the lungs are not able to perform the roles that they are supposed to do, either because there is fibrosis or scarring within the lungs, or there are other conditions that prevent adequate airflow into the lungs. So there is a lot of blockage. So sometimes these people with COPD can present like the asthma, but they can come with, can also get breathless. They can have cough, long-term cough, especially chronic bronchitis. They can also have difficulty in breathing, breathlessness, wheezing, and all those other conditions. So once you have a patient like that, or once you have anyone who you know who probably has these symptoms, they need to get experts review them and do some tests and make a diagnosis, and of course manage them. The reason I'm talking about them today is because they are lifelong treatments, that it is not a one-off that you're going to treat today and everything is done. Most of the time they are sort of irreversible illnesses by the time they are categorized as COPD. So how do we maintain a good quality of life? Of course, there has to be that management that they're getting from hospital, but also we recommend, as Bida Healthcare, we recommend some antioxidants that can be tied alongside the conventional treatments or the conventional medicines, and so that we have an improved quality of life. Someone can even be more productive. They are not disabled. Someone is not disabled because of the illness they have. So you can find more information at www.bidahealthcare.com about asthma, about COPD, both in the young and in the old. You can also follow us on our social media platforms, Facebook, Twitter, Instagram, and of course our YouTube channel. You can find a description of some of these management strategies that you can use both hospital and home, so that we improve the quality of life of people who have been diagnosed with some of these conditions. It is not an end. When a diagnosis is made, it is not an end. Rather, it's knowing how to manage that so you remain productive in your society, in your family, and in your country. Cheers to good health, and thank you very much.